Thank you, Minister. So, given where we are at this stage of the pandemic, with really quite significant transmission of the Omicron variant in the community, and with the attendant very significant pressures on our PCR testing system, and with the millions of rapid antigen tests that Victoria has ordered about to arrive, it's clearly time to recognise that a positive rapid antigen test has the same authority as a PCR test. And certainly we know that based on laboratory data coming in, greater than 90%, and in some laboratories greater than 95% of people who have a positive rapid antigen test go on to have that positive result confirmed by PCR. So in the current environment, rapid antigen tests provide a really high degree of diagnostic authority. And that's why other countries around the world, including, for example, the United Kingdom, did shift to the use of rapid antigen tests in a similar way when they got to this point. So this is the biggest change to our testing system since the start of the pandemic. And in terms of context, I think it's important to reflect that the number of people that our PCR testing system diagnosed yesterday was greater than the number our PCR testing system diagnosed for the entire of 2020. And it's likely that in the first 10 days of this year, our testing system will diagnose more people than it did all of 2021. That's the sort of volumes we're talking about here. So these changes mean that people who, as the Minister said, who have a positive rapid antigen test will be considered as probable cases of COVID-19 and subject to the same requirements as people who have had a confirmed diagnosis through PCR. They must isolate immediately for 7 days and notify their contacts. It will also be mandatory for those individuals to report the result, the positive rapid antigen test result, to the Department of Health through either an online form or by phone. And this will allow the department to confirm case details, to monitor the ongoing spread of COVID-19 through our community, which is incredibly important for supporting planning around our health system responses, and perhaps most importantly, ensure that people can still access care if their symptoms are deteriorating or if they've got risk factors for progression, and also to access welfare and other support. Once a probable case has reported their result on either of those mechanisms, they will be provided critical information on the next steps, on their 7-day isolation period, and how they can access the care and advice they need to keep them safe, just as would happen if they had been diagnosed through a PCR test. So these online or phone-based and phone-based reporting systems will be active from at some stage during the day tomorrow. It is a simple form based on the kind of essential information that we currently glean from cases, including a check on the severity of their symptoms. Privacy will, of course, be protected, and translation support will be available through the coronavirus hotline. Probable cases will also be reported alongside our daily confirmed case tally, so that everyone's aware of how the system is functioning in terms of providing diagnosis. Until rapid antigen tests are in increased supply, Victorians who have symptoms of COVID-19, or those who are without symptoms but are household or household-like contacts, can still get a PCR test if they don't have access to a rapid antigen test at that point in time. But in the future, this change means that PCR testing can be reserved for specific circumstances, such as the confirmation of clinical diagnoses in vulnerable settings and to support critical workforce testing. So in terms of confirmatory PCR testing, anyone can still get a PCR test to confirm their rapid antigen test result if they wish. However, this is really only recommended for people who have no symptoms and who are not contacts. And the reason for that is they are the least likely to actually have COVID-19, and therefore that confirmation can be sought if there's an unexpected positive rapid antigen test result. For people who do have symptoms or who are close contacts, if those people have tested positive on a rapid antigen test, they are much more likely, as I said before, 95% likely that their PCR test, if they have it, will be positive. And so we actually are discouraging people at this point in time from going through and confirming a positive rapid antigen test if they have symptoms or if they're a close or household contact. Because, as the Minister was laying out just then, in our eyes, in the eyes of the department, you have COVID. And all of the requirements, the public health requirements around that, but also access to clinical services and welfare support is contingent upon that positive test. I'll also add that your requirements to isolate start at the moment you test positive on a rapid antigen test. So if you do elect, and we are discouraging people from doing this, but if you choose to confirm with a PCR test, you have to be, that has to be your one trip out of isolation. You're not allowed to go shopping, you're not allowed to go and visit people. You are in isolation because you have COVID-19. Briefly across the rest of the testing network, yesterday, as I was just mentioning, was another day of very high demand. There were some suspensions at major sites. Really continue to thank everyone for their patience in this challenging time, and also to thank our testing providers, those at the testing sites and the pathology crews who have been working so hard to try and address this fundamental challenge being faced not just here in Victoria and indeed not just in Australia but globally.